Welcome to another episode of the FGW Podcast, where we educate, enlighten, and entertain. Today, we are diving into an issue that affects us all, yet often goes unnoticed until it is too late. Our topic of discussion for today is antimicrobial resistance. Joining us today is Ibrahim Ndamini Isah, a passionate advocate and student from the Department of Medical Laboratory Sciences, Newgate University, Mina. He is on a mission to raise awareness about how our misuse of antibiotics and other antimicrobial drugs is putting our future at risk. So stay tuned as we unpack what antimicrobial resistance really means, why it matters, and what each of us can do to fight back. So Ibrahim, welcome to the FGW Podcast.
Thank you very much. It's a pleasure to speak with you and to be able to have this opportunity to advocate in regards to antimicrobial resistance.
All right, so let's dive in. What exactly is antimicrobial resistance?
Okay, antimicrobial resistance, in a simpler term, occurs when microorganisms like bacteria, viruses, fungi, and parasites, when they evolve to resist the effect of medications that were previously effective for treating these infections. So what am I saying is that all the drugs that were effective, or all the drugs that used to be effective in treating microbial infections or microbial diseases, they stopped working, or they became less effective or even useless. So antimicrobial resistance is a global menace. What do I mean by that is that it makes patients to stay in the hospital longer, because in a case whereby it could be a wound sore or anemia, which is when the individual is infected with microorganism and it has circulated the system. So we find out that maybe in his test result, the bacteria has resisted all the drug prescription against it. It's resisted it. That means those drugs cannot work or cannot treat that infection or disease. So that's in a general sense, or basically, that is what antimicrobial resistance is all about.
All right, so basically the AMR, that's the antimicrobial resistance, this is when germs stop responding to medicines that normally kill them.
Yes, we can safely say that.
All right, thanks for that explanation.
But in a better term, we should not put it as germs, rather microorganisms. And if we're talking about microorganisms, these are organisms or living things that once they get access to our system, they cause a deviation from normal to a pathological state, which is a diseased state.
Okay, so how does this antimicrobial resistance happen?
Yeah. Okay, so antimicrobial resistance happens in different ways, actually. It has different causes. So, and one of the causes is overuse and misuse of antibiotics is one of the main reason why antimicrobial resistance happens. So let me go a bit deeper into this. So for example, I will be using examples and scenarios to understand so that our listeners can have a clear view of what this antimicrobial resistance is all about.
Okay.
The example I will be giving now is we've had cases whereby patients will just notice little symptoms. Maybe a patient is having catarrh. Let's start with something as simple as that. A patient will have that is having catarrh and slight headache, congestion in his nostrils. So he just goes to a counter or a medicine store where they sell medicine, and he gets an over-the-counter drug for catarrh. Let's say the individual can just say he wants to buy loratadine, or he wants to get a cough syrup or a catarrh syrup, without even going to the physician's desk, or without visiting the medical doctor's office, or without going to the medical doctor. He just goes over to the pharmacy, get the drug, and take it without prescription. This is misuse. When I first mentioned the cause, I said overuse and misuse. So now, antibiotics. So for my listeners, antibiotics is the drug that is prescribed to treat bacterial infection, or rather bacterial diseases, whichever one it is. So now, the overuse and misuse. Overuse. Now, let's say an individual has a bacterial infection. Let's use that. Sometimes women are victim of this toilet-related infection. They are caused by bacteria. So now, if it is a UTI, that's the urinary tract infection, there are some specific class of bacteria that can cause that. If it is that, now, a woman that has symptoms of that, maybe painful, youthful discharges. So if it is after that woman sees these symptoms, okay, she thinks, okay, it is UTI, then she probably goes to the doctor or the physician for proper treatment, and the physician, after laboratory confirmation, he issues out drugs that could work against that bacteria that is causing that infection. So after that prescription, and she takes the prescription, the doctor will give her a specific prescription. Okay, take 2 in the morning, take 2 in the evening, or take 2 in a day, 2 the next day, till that individual is done with the medication. Now, in a case where that individual uses that medication, instead of 2 a day, she takes 2 in the morning, 2 in the evening, 2 in the afternoon or night. The next day, same thing. Then, after that period of that medication, she has that same occurrence of UTI, maybe some months later or weeks later. Then she does the same thing. Instead of going to the doctor for prescription, now she's taking the prescription that was given to her initially. And there's a case that it could be a case that the bacteria that caused the first UTI might not even be the one that caused the occurrent UTI. It might not be that bacteria. Or even if it is the bacteria would have probably evolved. Okay, the last time this medication reduced my population, or the medication killed me, so let me change myself, let me resist myself from that drug. And before you know, because of use and reuse, the bacteria evolves and the drug won't even work again.
Okay, so sorry to butt in. Basically,
okay,
the antimicrobial resistance, it happens due to overuse of drug, right?
Not only that, it is one of the reasons.
All right, so that's what I want to clarify actually.
I'm just giving these scenarios so that my listeners could understand what it is really about.
All right, so can you tell us why this antimicrobial resistance is such a big deal? Why does it matter?
Yes, I can. Because why this is a big deal is, first, it is a threat because it can lead to longer hospital stays, higher medical costs, and increased mortality. For example, I have a very personal case. It's a relative of mine, but that relative stayed in the village. So what happened was that the man had an injury, an open wound in his left leg, and it was infected with bacteria. So, the village they don't have this proper hospital or proper lab for maybe confirmation and sensitivity test. So in a nutshell, they were just doing this random treatment. They will just clean the wound on the wound and no proper medication. They were just giving medication out of guessing and all that. So it took a very long period, and this wound started rotting. It was rotting. Before you know it, even got to a case where the wound was removing pus and it was very smelly. Nobody can stay in the room where that man is.
Wow.
And what was happening was that the bacteria was multiplying. Longer hospital stay, they were just loading him with drugs that weren't even working. So as it got to my hearing, I was like, if they keep that man there, the last thing that will be done will be amputation. His limb would be amputated. So I said, just bring the man over here. They should do wound culture for him. What I mean by wound culture, they will swab his wound and take it to the lab and they will do testing. So after a while after all the back and forth with the laboratory testing, so they found out that the bacteria that was localized in that wound was resistant to most of the drug, most of it. So the ones that it was sensitive to, he started taking it. Although it's even at that, it took a very long time before he healed. But still, you still know that something really happened to that man's leg because it was a thread line to amputation, a very thin line to amputation. So basically, it would higher medical costs and increased mortality. So common and minor infection, it could just be a common infection or just minor injury, and before you know, it becomes really fatal. It will take very long time, or it could even lead to, as that case that I just gave, amputation. It's a menace, and it also threatens the medical procedures. Imagine just surgery, a small surgery that is done, and that surgery wound refuses to heal because of antimicrobial resistance.
Okay, so what can people like everyday Nigerians do to prevent this?
It is very simple and direct. Once you have symptoms, go to the hospital, meet a physician, see a physician. When the physician assesses your symptoms, the sign and symptoms, ask for laboratory confirmation. It is very important to ask for laboratory confirmation before prescription. Now, that laboratory confirmation is crucial because you won't blindly treat a patient, because an ailment or a disease diseases can have the similar symptoms. So
is it the doctor that needs to seek laboratory confirmation or the patient?
The doctor would request for the laboratory confirmation.
Okay.
And other things that an everyday Nigerian can do is to avoid the misuse and overuse of antibiotics or any antimicrobial drug. Don't do personal prescription, no, and don't overuse whatever drug that has been prescribed.
All right, so in summary of what you said, the antimicrobial resistance, they are bacteria. This is when the bacteria do not respond to medical treatment, and it also happens due to overuse. One of the reasons it happens is due to overuse of drug, right?
Yes. Overuse and misuse.
All right. So is there any other message you would want people to remember about the antimicrobial resistance?
Yes. The message I would love to pass is antimicrobial resistance is real. It is happening. And if we don't do the needful, it will keep happening. And let me quickly quote that in the words of my lecturers, these microorganisms are smart. They are evolving evolving, they are changing, they are undergoing mutation on a daily basis. So they know what they are doing also. So it is important we also know what we are doing. We don't do things out of blind sight. Rather, we seek professional help. So rational use of antibiotics or antimicrobial drug is very important. Infection prevention and control. Then public education and awareness, which is what I am doing now, is one way forward. That's it.
So thank you, Ibrahim, for this insight and educative advocacy you brought to us today. I would like to thank you for joining us for this podcast, and thank you, the listeners, for tuning into this episode. And I hope that you all will take a very important lesson from today's episode. So thank you, Ibrahim.
Thank you very much for giving me the opportunity to come and do my advocacy with you. And I will also look forward to having a 2.0 because it doesn't stop here. Rather, I want this to get to the ears of many, the commoners, the bourgeoisie. Everybody should know about antimicrobial resistance. Thank you so much.
All right. Thank you. Have a good day.